Hi, this is Richard Dykman. We're doing a office hours session of Diabetes University where people that have written in with questions get to have them answered by Dr. Bernstein, who we're here with right now. So thanks for doing this, Dr. B.
Oh, I'm glad to be here.
All right.
Thanks for producing this.
Ready to get started?
Yeah, I should make a little warning, namely that I'm answering personal questions about humans who have a medical history, who have a body with things that one can look at when you examine them. And these are people sight unseen. I don't know them. So my answers are guesses. They're not absolute answers or advices, but they have probably good likelihood of being reasonable responses. The Diabetes Solution is a book that gives the basic step-by-step methods for keeping blood sugars normal, but I don't cover everything. There must be things that I left out, that I forgot about, and these come up in the questions that have been asked subsequently to the printing of the book.
I mean, the book, how big is the book? Seems like
it's 500 pages.
Okay, you're leaving stuff out still.
It would have been more. I think it's 540. The publisher limited the number of pages, so I couldn't say everything I had to say.
All right, you ready to start the questions?
Yes, sir.
Okay, the first question is about a boy who's 9, and his father and mother are concerned because his total cholesterol levels, I guess he has written here that the cholesterol levels are around 400. And what does that mean, and what is his course of action that you recommend?
Well, these parents probably have not read about the cholesterol myth or the fact that cholesterol per se is no longer considered a risk factor for heart disease. In fact, cholesterol is necessary for existence. Many of the substances of the body are made of cholesterol or derived from cholesterol. So cholesterol is essential for life, and it's hard you have to really strain yourself to find a modern study that blames cholesterol for any of our illnesses. So we don't look at it anymore. Now, I say I'm talking about modern, up-to-date physicians. Even the U.S. government's dietary guidelines, which criticized cholesterol, told you not to eat eggs or foods containing cholesterol. This has all been withdrawn because we now call it the cholesterol myth. If you're looking for heart attack risk, you'd be wiser to look at markers of inflammation, of which there are many. Some of the more common ones that are measured are C-reactive protein, fibrinogen, homocysteine. There are a lot more, and we've discussed these in a prior video. And in my experience, as a matter of fact, lipoprotein small a in people whom I've seen has the strongest correlation with heart disease if it's elevated. So these are not involved with cholesterol, and stop looking at cholesterol. I don't measure my own cholesterol. There's another study that we recommend for people who are worried about heart disease called oxidized LDL. And the reason I recommend that is because when these plaques were found on the aortas of young men killed during the Korean War, they were not LDL or cholesterol plaques. They were oxidized LDL plaques. And for that reason, and that's what we find in real human cadavers. And we know, for example, that high blood sugars increased the rate of formation of oxidized LDL and also increased the rate of formation of glycosylated LDL, which is only measured in research studies. You can't get it commercially yet. But the various risk factors, including inflammation, tend to be higher in diabetics and also in people with low thyroid function. So the game plan is always to control the blood sugar because that's the major underlying factor. There are also imaging studies that we've gone into in other videos that I use on my patients before giving them a strenuous cardiovascular exercise program. Mm-hmm. But that's basically the picture. You don't waste your time looking at cholesterol.
So, but this guy might want to check his free T3 or.
Yeah, I think the hypothyroidism, especially defects in the conversion of T4 to T3, which we talk about in a thyroid video, are so common amongst diabetics. Almost all of my diabetics have low free T3 before I see them. It should be a routine thing to check in diabetics. And if the patient, once their blood sugars are controlled, has normal T4 and T3 values, these are thyroid tests, you could probably leave them alone, or you might want to check it every 5 years. But if you're treating them, you have to check it more frequently, probably several times a year.
5 years, okay.
Much more important than looking at cholesterol, which is a non-risk factor.
So you don't want to just look at cholesterol to try to determine if you have a thyroid problem. Just look at the thyroid directly.
That's right.
All right. All right, let's move on to our next question. So